Good afternoon, everyone. Welcome to the first interactive webinar for special education surrogate parents, presented by the Recruitment, Training, and Support Center at the Federation for Children with Special Needs. My name is Janie Kreco, and I'm the Training and Support Specialist at the RTSC. For those of you who are not familiar with the Federation for Children with Special Needs, a little background. We started in 1974 as a coalition of parents who advocated getting the first special education laws passed at both the state and federal levels. We continue to provide information, support, and training to families whose children have special needs, including those at risk culturally, linguistically, economically, or with special health care needs. We also provide technical assistance and training to professionals and educators throughout the state. Our presenters today are Elaine Arsenal, Recruitment and Training Specialist at RTSC, Terry McLaughlin, Transition Specialist at the Federation, and me, Janie Kreco. We all have years of experience formulating and facilitating IEPs, and hopefully can provide you with more information on PLEP so that we can better serve our students. And our IT Director today is John Sullivan. Welcome, everyone. This webinar is being recorded so that those who could not attend today can retrieve it on our website at a later date. And the web address is www.fcsn.org. Some technical pointers: everyone but the presenter will be muted so that background noise is kept to a minimum. If you have any questions, please use the toolbox to submit them. Elaine and Terry will be watching the questions come in and will present them to the panel as time allows. Okay, let's go. Special Education Surrogate Parent Interactive Online Discussion, PLEP, Other Educational Needs. And here's pictures of us. You can see, become a little bit more personally acquainted with us. Do take note of our email addresses and our phone numbers if you have questions later on and want to call us after the webinar. So our points of discussion today are to explain exactly what PLEP is and what it means for our special education surrogate parents, an examination of the parts of PLEP and how to use them in the best interest of the SESP students. And although we probably won't get to point 3, we are going to talk about goals, if not today, for the next webinar, which will be next month. And of course, the important part of that is to make them measurable and acceptable to the IEP team. So, what is PLEP? PLEP stands for Present Levels of Academic Performance, and the B part refers to other educational needs. So the Department of Education, in their IEP process guide, and this is a quote, says that the team must take a broader look at the student's overall involvement within the school, including participation in extracurricular and non-academic activities. Some of the things that the team needs to consider are how students communicate with others, and importantly for our kids, how the student's behavior affects their learning or the learning of others. Also very important for our kids is how the student's disabilities affect transition to post-secondary activities. Terry and I gave a presentation a few months ago on transition services for kids, and she is very, very knowledgeable on all parts of transition. And it was a great seminar together. Thank you, Terry, for joining me on that. There are a few things in transition that directly affect SESP students, and you can call me later if you don't have knowledge of those. So I've kind of cut and pasted what the actual document looks like. And take a few minutes to look at the first part of PLEP, and this is the top half. When you see that there are general considerations and that we should check all that apply, there's what, how many, 4, 5, 8 different, no, 12, sorry, 12 different areas of general consideration. And this is not an exhaustive list. There's that other down at the bottom there. and we'll talk a little bit about some of the things that are other and that you can consider. The age-specific considerations, Elaine and I spoke about this briefly prior to the webinar. They generally are referring to transition between different parts of the education. 3 to 5 is going from preschool to school age. 14 and above or younger is going from elementary to secondary. And then the third box is for kids that are going to be aging out of the of high school secondary education into post-secondary education. And that is Terry's area of expertise. So again, a quote. The federal law requires consideration of a variety of special factors, but the list is not exhaustive. So, what is it that SESP should especially consider? Extracurriculum activities. And I believe that they are referring there to things that are non-academic but are also, now what did we say about this, Elaine? We talked about it before.
These would be activities that would be like after-school activities, a cooking class, sports, or any type of activities that were part of the school program that were not academic.
So, so they are within the curriculum because they are part of the school day, but not necessarily academic.
Right.
Okay. When you consider that, we'll move that forward as far as what it means for PLEP and for goals. Social emotional needs, I think that all of our kids probably need special consideration for that. Communication, and that is not, there's two parts of it on PLEP. One of them is for assistive technology, but I think that this is referring to communication, possibly nonverbal communication. Terry, do you agree with that? Nope, she's saying no. Yeah.
In general, communication, it means for all students. So
okay.
If there are communication issues that any student has, this is a good place to begin to talk about it and determine whether or not it's to the extent that you would need to write a goal to support the student. So
okay.
it is for all students.
And would it be for someone who doesn't, for example, read social cueing?
Sure.
Is that the kind of communication
Yep.
they're talking
Yep.
about? Okay.
And, you know, you'll find that as you look at these, some of them are going to, you know, more from one place to the other. It really depends on the student. The whole point of this is to really get at the things that wrap around the student, the social, emotional, and non-academic things that happen during the school day to give students full access to the whole school experience.
Mm-hmm.
And that's where PLEP really hits the mark.
Thank you. And then of course we have behavior, which I don't think that needs too much explanation, always something that needs to be taken into consideration. Yes, Terry?
Yeah, one thing I want to comment about behavior is it doesn't say bad behavior.
No, it does not, and I just was thinking that when I said that.
So it's important if it's behavior that the student is exhibiting that's affecting their ability to access the general curriculum, it's something that you need to talk about and possibly address on the IEP.
So even if a kid is just like unfocused and kind of glancing all around the place or else getting up and out of his seat a lot, mm-hmm. Not necessarily inappropriate, well maybe inappropriate but not bad, but that would be considered a type of behavior.
Sure, any behavior that's affecting his ability to function in that classroom environment or in the school environment mm-hmm. should be talked about and addressed.
Right. Good. Okay. And we come back down to the non-academic activities and to differentiate between that and extracurriculum activities. Elaine, we talked about the fact that that would be before and after school programs maybe, or
the non-academic would be more around things that are going on in the school, like
recess?
gym and
okay.
recess, lunchtime, areas of the school where the children would be interacting with other children and staff, and how do they move themselves through that.
Mm-hmm. And those of you that are listening out there in webinar world, please, if you have a comment to make or a question, please don't hesitate. Go ahead and type it in, because Elaine and Terry are monitoring the keyboards there. And then the final point that is actually in this explicit 12 boxes is the skill development related to vocational preparation or experience. And that has to do, I believe, they're referring to post-secondary vocational skills. Although it doesn't necessarily have to start at age 14. And I think that's an important point to make here, is that for kids that we can see are going to need a lot of skill development, it can start way before 14. That's true, right, Terry?
Yeah, I mean, this was changed. Previously it said vocational education, and it was misunderstood to mean that all you need to do is check this box and the child would go to vocational school. You know, transition is really preparing students, preparing them for whatever they're going to do in the future, you know, based on their vision. So as you look at this skill development related to vocational preparation or experience, it really does guide you to that end. So it's really focused on what does the student want to do in high school and after high school, and what type of skill development do you need to address and talk about at this point in time in order to make that happen. It's preparation. It's not an absolute. Transition is always preparation for whatever it is.
So it's not necessarily a particular program that we're looking at, but the preparation.
Okay. That's correct. And it's never, I mean, we're never looking at a specific program. The IEP always comes first. You know, what are the goals in the IEP? What does the IEP say that the student needs? And the last thing that you choose is the placement, is where it's going to be. Identifying the student's needs and writing really good measurable goals are important to happen first before you make that determination of a placement.
And the DOE in their IEP process guide repeats several times that none of this is a placement thing. It's all about the preparation, and placement is only considered after the IEP is totally written. Okay, so let's go to the next slide and see what we got here. Oops, wait a minute. Let me just click on here. Okay, so the second half of PLEP B, and I apologize, this is very small, but if you look at the actual document itself, it's very small and very kind of hard to read. So we're going to break it down even further, and I think that we're going to start with, first of all, and this is just taken right off of the PLEP B document. How does disability or disabilities affect progress in the indicated area or areas of other educational needs? So my question throwing out there is exactly what goes here. In the years of my writing IEPs as a teacher and as a parent, this was where I put the result of assessments evaluations, and specifically a baseline, so that this was the point from which effective progress was measured. How do you two feel about that as being an appropriate thing to go in this area? Terry?
Well, I mean, I think assessments are important. So obviously, whenever assessment has been requested, I think it needs to be noted a number of different times in the IEP. This would be a good place to put assessments to.
And Elaine, has it been your experience that this was a good place for that to go as to what the evaluations determined were going to be an area where the student would need other educational accommodations and
Yeah, I think correct that this is a good place because you do want to know from what baseline you're coming from in order to, you know, map the effective progress or measure it. You really need to know where you're starting from.
The problem, of course, here is that we're not talking about an academic baseline.
Right.
And to get a baseline for social emotional needs can be a little tricky.
Right.
Especially for kids who have a history of social emotional issues. But it needs to be stated, I think, because, again, effective progress has to be measured.
Right,
and or else we don't know whether or not the child is proceeding.
And I found even, you know, not only assessments and evaluations, but parent documentation around where this child is in their social skills, you know, around home, around buses, around other activities that the families engage in. The parents really know where they're at as far as being able to be, you know, effective in those areas.
Yeah, we have a couple of questions here, and I wanted to just get a sense. Yeah, I just wanted to check with them, because some of them relate to some of the comments here. And one of them was a question about emotional needs in high school. And the parent comments that my child's high school would not accept her emotional needs in the IEP. They just said she had a bad day and needs to tell someone. And so I think that this is something that, you know, obviously there are very few kids in high school that don't have emotional needs. But when a child's emotional needs ramp up to the degree that they're really not able to attend, or they're not going to class, or they're leaving class early, this is when it kind of ramps itself up to, we need to address that, we need to talk about that, and an evaluation might be an appropriate thing at this point in time. So it's always trying to think about how does the emotion impact the student's functionality. And when we talk about transition, we're really talking about continued skill development. So, and that's what each child is very individual. Some kids are going to change and they're going to need support because of mental health issues in high school, and it's just like any other disability. We really need to address it, and assessments are really helpful to do that. And Elaine commented on the parents, and they can be very helpful. You know, assessments can be formal or informal. You know, parents documenting information, tracking it, writing it down, logging it in, so that when they go to a meeting, to be able to express these concerns and link them to specific behaviors or incidents in school and incidents at home, reinforce that this is really affecting this child's functionality in school.
Would this be a good place to mention a functional behavioral assessment and a behavior intervention plan if that were had been performed for these students?
Sure.
I think it would be.
Sure.
Elaine, what do you think? Especially if it's a specific behavior that we're going to need a goal around.
Right, right. And I think like some of the skill building that, you know, we talk about is, you know, some children have anxiety or low tolerance for certain situations, and how to help them build those skills around that, and not just say you're having a bad day, go tell someone. They need to actually be taught how to move forward and deal with specific situations like that. And
it's interesting that the person that wrote that in, you know, my instinct would be to say that if that high school student is having bad days, a lot of them in a row, or, you know, frequently, that should be in the grid, that she or he would have the ability to go speak to somebody under certain conditions.
Sure. I mean, I think that's the whole purpose of the IEP, that you need to make sure that you're addressing all those needs of the student, and they'll morph and change. You know, the more they're involved in experiences, both academic and non-academic activities that they enjoy, the more likely they're going to be more engaged in school. So it's really sitting down strategically planning for students so that they can move forward. It also will make it will be some determining factor with regard to their choices for post-secondary education or work or whatever it is they're going to do after high school. Because tolerance continues, and we need to address it and give them strategies so that they can continue to learn and move into something that's meaningful for them.
And so my second point here is, should the diagnosis of an emotional disability be stated at this point? Now, I'm not talking about the criteria for being on an IEP. I'm talking about the actual DSM-4 or soon-to-be 5 diagnoses. Many of our kids in SESP's kids have post-traumatic stress disorder, anxiety disorders. And how meaningful are they? A lot of people say every diagnosis is individualized and different for every child. Elaine and I saw Ross Green this weekend at a seminar, and what did he say exactly, Elaine, about diagnoses? He's not a big fan of them.
Yeah, he was talking about how it wasn't really meaningful to have a specific diagnosis on the IEP or for people to diagnose children, because then they get stuck on that label, and it's not about the certain disorder because each one might present itself differently, but what you really want to look at is behavior and how the behavior is impacting the life of the child at the school or at home or in situations.
And the mention of complex trauma, I think, is a good thing here because that takes in a lot of symptomology. It also kind of turns people's thinking towards something other than behavior. And when, Terry, you said bad behavior, most people do associate behavior with bad behavior. But complex trauma puts it in a whole different lens. It covers a gamut of symptoms from relationship problems, assertiveness, aggressiveness, anxieties, all kinds of things. So I would advise people to go ahead and mention in the this PLEP-B here, how the disability affects progress, to mention that the child is suffering from complex trauma. I'm going to read to you one of the, Elaine and I did a seminar and we presented an imaginary child whom we wrote an IEP for and a functional behavioral assessment for and a behavior plan. And what we wrote for this part was, the little girl's name was Drew. We kind of made that up. Drew has a diagnosis of post-traumatic stress disorder. I did say DSM 309.81. Most people would not know that, but because I'm a clinician, I did know that. So, but due to her complex childhood trauma, her disability includes intense impulsivity, especially at times of high excitement or stress. She has difficulties reading social cues and finds it difficult making friends. When Drew feels unsafe, especially when an adult in authority reprimands her, she can become highly defensive and either swear or lash out verbally. If a peer group shuts her out, she can either become very embarrassed and depressed or respond with swears. She is alone at recess much of the time. So that is how her disability affects progress for her social emotional needs, for her behavior, and in her non-academic activities. Those were the three parts of general considerations that we had checked off at the top of PLEP-B. Okay, so let's move forward here and let's talk a little bit about other things that can impact academic success that are not part of the 12 general considerations. Speech and language delays. Kids with trauma many times suffer from language delays and speech delays, especially at earlier ages. But even at the high school level, they can process a little bit slower than their peers. So they may appear to be inattentive or not listening, whereas in fact they sometimes are just taking a pause to process. Delays of life skills, and that can be from toileting from a preschooler all the way up to independent living after they leave high school. Inability to read social cueing, like our little imaginary Drew. Poor peer relationships, blurting things out in class, that's impulsivity, and consistently making poor choices. These are all things that can impact academic success and can be stated in PLEP-B for which goals can be written. And just let's talk a little bit among ourselves here. Have you ever written IEPs, you guys, with goals like this?
One of the things that always hit me with working with children in DCF custody was the delay of life skills. A lot of times there might be hygiene issues that keeps them from being able to make friends
No
or
showering.
to be accepted into the groups. And still being able to be part of groups is a part of, you know, like if you're in a reading group, you don't want to be the kid that nobody wants to sit next to.
Because you smell bad.
Right. And so a lot of the children that I encountered, because of low self-esteem or trauma or whatever, had, you know, these really bad ways of peering when they would come to school. And then also being able to read the social cues so that they had bad boundaries. They would either get into the group too quickly or get too close to people or over talk, or they would just not be able to even enter a group.
Didn't have the social skills to do that.
Right.
So if we were to, let's talk about personal hygiene a little bit, because I agree that many of the kids, in fact, probably a majority of the kids do have personal hygiene issues to some extent. Our supervisor just walked in, so hi, Peggy. She doesn't have a microphone, so she's just going to maybe write down questions for us. So how would you go about incorporating that into an IEP, and is that appropriate? Terry, is that an appropriate goal in an IEP?
Well, again, you know, it's hard to say everybody needs this or everybody needs that. It's such an individual discussion. So if it's an issue that we all as a team can sit down and say, yes, this is affecting this child's ability, as Elaine said, to participate in a group, to have meaningful friendships, then maybe it's something we should put in the IEP and all talk about how could we help this student. So it might be some sort of an assessment. It could be an independent living assessment that would give us a sense of what he needs. There are lots of assessments. Some of these, as I said, there's formal and informal. There are things online that you could look at, and maybe the parent could fill it out, the surrogate parent, the student could fill it out,
the staff person,
staff could fill it out. Yep. You could get a sense. Okay, so what are people saying about this student? What are they? What do we feel we could do in school to have him as more participatory experience? And so that's what you need to do. It's not like say this kid needs this or that kid. Every kid should have. It's really if the kid is not participating with other students, if they're not really part of the conversation, if they're always being excluded, as a team we should sit down and try to figure out what can we do to try to make this happen.
Health assessments used to be used frequently, and I know that they've kind of, and home assessments also, have fallen a little bit out of favor, but they are still possible, right? I mean, if a child has very poor hygiene, you could do a health assessment on him to determine a baseline. Right?
Sure. I mean, that's what I mean. I think as you sit down as a team, and it's harder to talk about every child. When you sit down as a team and you address one child, okay, so what are we going to do? Is it going to be a health assessment, a home assessment? Is it going to be an informal conversation? We begin with just a set of questions. Can you do this? Can you do that? And I think when people put their heads together, they can really figure out. I mean, we have extraordinary expertise in schools, and we need to use that expertise and support each other to support these children.
And a nurse's assessment, I think, at that point might be a really good idea.
Absolutely. She's a great person to be on the team.
Yep, and not necessarily always in the team.
Absolutely.
Yeah. So that's a great point to make. Poor peer relationships. A lot of these things appear to be therapeutic goals or counseling goals, and they are, but they're not just one-on-one types of things that we need to look at. We need to look at them in the whole school life. And I know that some people, the easy out is to say, okay, well, we'll put her in a social, or him into a social skills group. But for me, that's okay, but it doesn't take it far enough. It needs to be incorporated into the academic day, so that it's not, so that the skills learned in the skill group can be translated universally, globally, and in more naturalized settings.
I think that's something that a lot of the schools miss, is that they have these little social groups, but what they end up doing is pairing a lot of children that have poor peer relationships with other children that have poor peer relationships. And how do you integrate them into lunch or gym or chess club with other children that have good social skills that they could learn and grow from? And you think that would be a given, but it really has to be written in, or it doesn't happen. There's no way to measure it, and there's no way to monitor it.
Yes, and that's going to take us to where we write the goals and put them on the grid. Yes, Terry?
And that's where I think PLEP can really be helpful. If you can take that student, identify a club, identify an extracurricular activity, identify something in the school that the student particularly likes or has a skill in, to help them to participate in that group. Everybody's going to do the same thing. Everybody's going to the activity for the experience.
Yes.
And that's where you can really work on those friendships. And that IEP can come in with a goal under PLEP-B to address that need that the student has in that skill area, which is not academic.
That's right.
Now it's social, but it's still just as important as the academic.
And I believe that the Massachusetts Advocates for Children call those places islands of competency, where you find those little islands where the child feels successful and happy and good about themselves and help to build those.
Right, and other students see him as successful, so it takes away that stigma. I mean, we can really help typical kids to learn how to have a more inclusive society if we have a more inclusive experience in schools.
That's right.
So even though they have difficulty in certain non-academic areas, when they come into our club or they're in the drama or they're in chorus, they can sing, they can act, they can be part of that, and so how can they're seen as a part of the team, as a part of the club, as a part of the group.
Yep, that's great. Okay, let's move on. Okay, so we're kind of moving down the page on PLEP-B, and the next part after we talk about how the disability affects progress, the next part of it is what type of accommodation, if any, is necessary for the student to make effective progress. Just another quote from the Department of Education, just so that people can understand that accommodations are modifications that are typically provided by general educators within the general education environment. So these are not changes to the general curriculum, but they allow students to receive information more effectively. This can kind of confuse people a little bit, or maybe the people that are listening on the webinar know exactly what we're talking about here, but it always confused me a little bit, the difference between accommodations and modifications. And the DOE does distinguish between the two. So accommodations, I think that it means things like small group learning, putting the kid in the front of the class, that kind of thing. And that it doesn't mean that they're tampering with the curriculum at all, but just sort of switching up the environment a bit. Right. Would you both agree with that? And Peggy, do you agree with that? Because you're the one that I learn a lot of this from. I know. Say yes or no. She does want to talk. Okay. Yep. We're going to have Peggy talk.
Hello, everybody. I just joined in. I think accommodations and modifications are very confusing, especially, Jenny, when you have this quote that says accommodations are modifications. Yes. And then when you look at PLEP-B or PLEP-A even, they talk about what are accommodations and then what are modifications. Yeah. My understanding, what I've learned here at the Federation, and Terry helped me with this, is that accommodations are what you said. It's sort of like general educators or special educators making changes within the environment that will help the students succeed. So that could be lengthening time to do work, doing it in a different format perhaps, one-on-one setting versus a small group or larger group. Modifications, I understood that to be, is changes in the curriculum. And when you start recommending changes in the curriculum and instructions, the student is no longer accessing the curriculum and all the other students. So you have to proceed with great caution when you're recommending modifications. Terry?
I agree.
Yeah.
I agree. I agree completely. I think that, accommodations, I always think of them as You know, it's the ramp to the building. It's the ramp to the information. It's the, you know, what do we do, as Peggy said, to the environment to make it work for everyone. And we talked briefly a minute ago about that group, that activity that the students are going to do after school, that instead of having it in lecture format, maybe we organize it in small groups. And that would be an accommodation that we would make just for the students so that the student would feel more part of the group. So it absolutely is. Once you start modifying the curriculum, you lose parts of the content.
Yes.
And we don't want to do that. If the student needs that level of support, it's really more specialized instruction, and it's a very different process and conversation.
What the IEP process guide again says is that the accommodations are generally done by general educators, and modifications are generally done by special educators or other kinds of specialists.
Right. And like we talked about earlier, Janie, someone made a comment here, accommodations do not change the expectations for achievement, whereas modifications actually change the expectations. And that was something we talked about earlier, like we
criteria.
Still have the same expectations for all the students to really achieve the same, you know, learning.
Yes, okay. That makes it a little bit clearer to me, actually.
Yes.
The different criteria. Yes, Terry.
And another comment, which I think is a good one, is that modified curriculum is, you know, you end up with a modified grade. So we're going to change grades. So again, as soon as you're modifying the content, you have to identify the grade or the evaluation of the student in a different way.
Yes.
So it needs to be clear which it is.
Yes, and I think that sometimes kids, tell me if I'm wrong, will get a regular report card or progress, I'm going to call it a report card, and that is based on the general curriculum. And they also get a report card based on the IEP and their progress notes. Have you ever heard of that? I've heard kids get two separate report cards. I don't know if anybody out there.
No, I haven't heard, not in Massachusetts. I mean, typically it's the same thing.
The same report card.
And
based on their peer, how they perform.
Well, yeah, I mean, it's based on their work in school with regard to the general curriculum, the general student, yeah.
Okay.
And the, you know, the progress notes would give you a sense of what they're making progress towards the goals in the IEP.
Okay.
Another comment here that I think is a great one. We've actually got some great comments. Accommodations do not change the expectation for achievement. So we still have an expectation that the student is going to meet their goals, they're going to participate in a meaningful way and have the same outcome as the other students. Modifications usually change the expectation because the student's needs are a little bit different and the outcome we expect is a little bit different. So these are all great comments, and it's very important to bring these things up at team meetings.
Yes. One of the problems that I have when I'm writing IEPs or when I wrote IEPs was if a student was in some kind of a program that had major accommodations throughout the school day. So it was a therapeutic day placement or a significantly different type of placement rather than the regular classroom. And kind of the rules change a little bit there because the accommodations are made for all children in that particular placement. And the problem, of course, is that should the child move back or forth on the curriculum of care, the continuum of care. So, for example, if the accommodations in a therapeutic day school are kind of stated as being for all kids in that placement, what do you do when they go back to the public school? Do you rewrite the IEP with accommodations? Does everybody understand what I'm saying?
I do, yeah. I do. And typically when students move, when the placement changes and students move from one placement to another, they're reevaluated and then the new IEP is written.
Right.
So it changes.
Yes.
The IEP, if a student moves into the placement with an existing IEP, typically once they get into that outside placement, evaluations are done, and they modify the IEP to support the student in that different placement. So the IEP is always the first thing that's done. The placement always follows it. And if the placement changes, you're going to go back to the step before IEP, which is assessment.
Okay.
So it's typically that same process: assessment, IEP, and then placement.
So would it be fair to say that accommodations are subjective to the placements?
Well, I would, yeah, I would say
Okay.
yes, because once you move from that school environment to a more separate environment, typically you move in there because in order for the student to be more functional within their day and not having to make all these changes to their day, in a therapeutic environment, they're receiving things much more naturally in the rhythm of that, that other environment. So they're learning how to do something in the context of that school setting. If you're going to move back into the high school, I'm just speaking specifically of a high school student, then you would want to make sure that there are opportunities within that high school setting and modify that curriculum somewhat so that the student can have that support, that emotional and psychological support throughout their day in order to access the academic experience.
Yep. Yep. I'm just going to quickly read one of the what we put down, Elaine and I did, for a type of accommodation for our little imaginary Drew. Now, this was all written before intense looking at PLEP-B, so let's see if I did it right, and you guys feel free to criticize. Little Drew. So Drew requires specific skill, but this is under types of accommodations. Drew requires specific skill building for social amenities like how or when to interrupt during pauses in conversation. She will require the recess monitor to give her planned praise when things are going well. In the classroom, Drew should be placed with specific peer support models. Planned praise and ignoring the specific target behaviors on the positive behavioral support plan are necessary for all teachers. Class responses should be predetermined so that Drew's impulsive blurting out can be curtailed. Now, Drew was in a regular classroom. She was not in a separate kind of therapeutic placement. So those were all accommodations, right? They were not, I'm getting the thumbs up from Peggy. Thank you, Peggy.
Yes,
and so
yeah, I would agree.
Okay, so that was, we did the right thing, Elaine.
Right. Good.
Okay, good. All right, so, no, hold on. Okay, so still talking about accommodations, and I think we've covered this a little bit. What if the school says they teach all students with school-wide accommodations, therefore individualized ones are not necessary? For example, small group learning, cooperative grouping, one-on-one counseling. And we talked about what happens if the student is moved to a different placement. I have had SESPs call me and say, the school says a goal is not necessary because it's a school-wide accommodation. And do accommodations require goals?
Well, I mean, when you're talking about accommodations, basically you're talking about a 504, but a student could be on both. A student could need that level of support that would ramp it up to special education depending on the need and depending on how much modification was going to be made to the curriculum.
But we're talking about accommodations, not modifications.
Right, right, I know. So I'm saying if it's ramped up to the level that it's really altering things dramatically, it really is a modification.
Okay.
If the school says they teach all students with school-wide accommodations, I would ask them for some sort of data to give you a sense of whether those school-wide accommodations link with the accommodations that the student needs. Is the student on an IEP? Is he on a 504? So it really depends on whether or not they mesh.
Okay.
You certainly could be in a school that provides, for example, small group learning, cooperative grouping, one-on-one counseling, but you would need to be able to identify that. In fact, that is what the school does, and they should have that in some sort of documentation about their school.
And the specific goals of a child, if they go, if we want to really pinpoint a specific skill of a child that he's having trouble with, and the school comes back and says, no, we do that automatically. And a lot of that is that skill building thing, the social skills stuff. They kind of put a school-wide thing in about, you know, we're always monitoring skill building, we're always, or social skill building. We don't need a specific goal about that. How do you feel about that? I don't like that. I would rather have a specific goal.
Well, it depends on the student. You know, we have to listen to the school too. I mean, if they claim to have that type of a school environment, that's wonderful. I mean, I think that's very, very positive. But you'd want to have some sort of evidence so that you would know whether or not, and then you could kind of look at that evidence and say, yes, but the way you do it is not going to work for this particular child, or that's great, the way you do it would be very effective with this child. But you could also say that in order for the student to move into that experience and have success, let's move in slowly, let's try some stuff, we'll monitor their progress and then take them off things as we go.
Okay.
But I think I would do two things. I would look at what's existing and see if you could identify that as supporting the needs of the student, and that it really insists that you have that monitoring of progress.
Okay.
And I would caution dropping things in the beginning, because that student might not succeed in that environment and end up in a different environment, and you still need to have those written goals in there. And if the school's doing them, great, and they're following the IEP. So I can't imagine why it would be good to have anything taken out yet until the student is actually succeeding.
And I agree. I think there's no problem with having the goal in the IEP, and when you look at the service delivery grid, you could say whole school, but at least it's on the service delivery grid.
Yes. Right.
Because I always like to write goals like, you move into Florida tomorrow. That IEP is going to go with you to Florida, and you want to make sure that IEP has those goals in there that you're going to need when you land in Florida. So if the school, it's very easy to put it on the service delivery grid. This is where the services, this is what the student needs, this is where the service is being delivered.
Peggy?
Terry, I absolutely agree with what you're saying. But it needs to be in the IEP spelled out, because what happens if that student moves to Florida? Well, our kids who need special education surrogate parents are apt to move quite frequently, unexpectedly. And it's great that this whole school is doing that. Small group, collective, problem solving, etc. However, if they move to another setting, that may not be happening there, and it needs to be spelled out. So I think we need to work with the schools and make sure that what they do for the whole school is written into our kids' individual IEPs, so that if they move, it goes with them.
Portable IEPs.
Yep.
Yep.
I agree completely, and I actually had a call, I remember very specifically, and the student was moving from the Cape out to Springfield. And they were very concerned because the services that he had been receiving were not on the IEP, and now he was moving out to Springfield with an IEP without that service, and they were really having a problem because he was, you know, he had family difficulties, and he was losing his family in one place and having to move all the way out to Springfield. He was going to be alone. He was 19 years old. So, you know, this is really, for this population, it really is very important to have the goals in the IEP.
Yeah. Okay. Did I skip something here? I apologize. No. Okay. All right. So what types of specially designed instruction? Again, some of the specially designed instruction can refer to related services like PT, OT, speech and language, that kind of thing. And schools get that. That's their go-to. They know that related services must go on PLEP B. But the modifications that affect content, delivery of instruction, methodology, and/or performance criteria, instruction designed by an appropriate, what am I doing here? I'm sorry, I've lost my train of thought here. Oh, I see. We're talking about specially designed instruction. Okay.
The methodology.
The instruction, if the curriculum is modified, okay, we talked about this, it really needs to be designed by an appropriately credentialed provider. And that has come up in phone calls that I have had about can the aide do this?
Right. Yeah. I've had the same kind of phone calls where there's on the grid it has that, you know, certain things are going to be given to the student by staff, What does that mean? I mean, staff could be the cafeteria worker. You really need to be specific about who it is and whether or not they know how to deliver that type of service in the appropriate way.
One of the things that people are always asking me is when a functional behavioral assessment is done, does it have to be a certified person? And many times the school will say, no, we can have the special education teacher do that. I would kind of question that because they are supposed to be appropriately credentialed, and to do a functional behavioral assessment you really need to be a board certified applied behavior analyst. If it's a specially designed instruction, and now we're talking about modifications, they have to be very clear and specific. It can't be generalized like the accommodations are. Does everybody understand the difference? I think that our people out there are understanding it probably better than I am at this point. But if anybody has a comment to any of this, please write in and let me know. All right, so let's look at the content of instructional modifications. And again, it includes specific changes to the prescribed Massachusetts frameworks, which is the general curriculum. And the prescribed Massachusetts frameworks is for typically developing peers. And one of the ways that people kind of look at this, and again, this is from the DOE, does the student need to learn just key concepts, or do they need to learn based on the full curriculum? And this can impact kids that we have as a population because many times because of their anxiety and their ability to attend or focus, their ability to do homework, all that kind of stuff is going to have an impact on the modifications of the curriculum. I know that that's not the best idea, and I know that many people would recommend not modifying the curriculum, but I think if it means moving forward rather than getting horribly behind, it's probably acceptable. How does the team feel about that?
Well, I think it's important to decide which the student is going to need. As we said before, as soon as you start modifying curriculum, you're changing the expectation and the outcome as far as a credential goes. When you look at a student who's going to, they're going to pass MCAS, so they're not going to pass MCAS.
Yep, that comes into it.
And so this is a big issue. If a student is going to be doing a portfolio with an expectation of the outcome of passing MCAS, and the portfolio looks totally different than for a student who's just simply putting together a portfolio and there is no expectation of the credential of a high school diploma. So I think it's important to remember, as soon as you start to modify that curriculum, you're changing some of the content. And just like if you're going for a bachelor's degree or a PhD, you have to receive all the content, and then you are judged and scored and evaluated on that content to determine whether or not you receive the credential. So modifications are good, but you need to make it clear in the conversation with the team what you expect for an outcome.
Okay, because I'm thinking that a lot of these kids get terribly overwhelmed trying to keep up. And this is more, I think, probably in the public schools rather than the therapeutic days programs or residential. They get terribly overwhelmed with the expectation that they are to complete certain tasks in a certain time. And with everything else going on in their lives, that they do fall behind. And I always kind of say to myself, which is better, that they become overwhelmed but can you be overwhelmed and keep up? Or do you have to modify the curriculum in order for them to be able to handle it?
I think that's a little bit of the difference between the accommodation and the modification, because you could do 15 spelling words as opposed to 25, but you're still learning the same curriculum that everybody else is. And the problem with modifying the curriculum, and I ran into this with my own son, where being in not a typical public school, they modify the curriculum to the point where when we started talking about graduation, he didn't have the right amount of curriculum and the right amount of learning, and then had to play catch up for 2 years, because all along we kept thinking he was going to graduate, but then when it came down to it, and this happens to children in residential placements, the curriculum that they have in residential schools is not always the same as in public school, and there's certain points and there's certain curriculum and there's certain days and times, and when you start pulling all the records together, they could be in 11th grade and be like a whole year behind, although they might still be in the number of the year. So we have to be really careful about that. And if they're going to pass and get a diploma and not a certificate,
Correct.
there are certain things that have to be done. And also the portfolios don't always end up helping in that area.
So we don't want to dumb down the curriculum, but we want to make sure that the accommodations are in place for them to keep up with the peers, where the peers are in the general curriculum.
Well, I mean, because ultimately the whole point is, where's the student going to go after they exit the entitlement of special education? So is the student going to move on to post-secondary education? Is he going to go to a community college? Is he going to go to a four-year college? Is he going to go far away? Is he going to go close to home? And all of this preparation and this work that's happening while the student's in school should be with that consideration in mind.
Always towards the future.
The students who are doing a portfolio and there's an expectation of passing MCAS, then it looks very, very different, and it may not sync with where the student is going to go. So where they're going to go is an important part of the conversation. It needs to be identified early on, and you need to be reaching towards that goal and making that plan and making these choices based on that all the way through high school.
Gotcha.
Right. And also, one of the comments here is about the child to have modifications because of lack of understanding. What happens is that's why they go till they're 22.
Yes.
It gives them that time.
Yes.
To catch up.
I agree.
And I like the idea of that, that extra time to catch up. Okay, well, we're getting close to our time. We have about officially around 4 minutes, 3 minutes. We can continue next month at this very point, but let me go to the last point, the little bullet that I made here. Massachusetts is creating behavioral health and public school framework. It is supposed to go into effect in 2017, I believe, right, Peggy? And a lot of schools, including the Boston public schools, are already using them. It is in the SESP resource manual. If anybody needs to have a copy of it, they can go on the DOE site, or I can send it to you. But it's interesting to think about behavioral health being a framework as part of the general curriculum, and the content of that can be modified. So kind of a different way to think about things. For an example, for GRU, my imaginary GRU, I actually did not have any change to content. So I don't have an example to give to anybody, but I think we've talked about it sufficiently for people to understand. So next month we'll pick up here. We'll start talking about methodology, delivery, and then the performance criteria and how how different disabilities can impact that. And then we're going to go into goals. Any questions that need to be answered before we sign off?
We had some great comments from people. I was really pleased that people took the time to write things in. One of the callers commented that about functional behavioral assessments may be done by a teacher for example, with autistic students. It's often better to have BCBAs. They're much more qualified for the FBA. But FBAs can be done by a trained person, and there are great trainings out there. Functional behavioral assessments are helpful for students when they're a little bit older. It might be good to do that assessment on the bus or at the work site or in some other environment to help figure out, okay, so how can we help the student in this different place? A lot of students become, even with their struggles, become very comfortable in high school, and we really need to look at how to get them out of that setting and into the community.
Yep, and that's about the goal, writing the goals. So we will continue this next month. I would like to thank everyone. John, you did a great job. Thank you so much. And we'll talk next month.
Thank you very much.
Thank you.
Thank you. Thank you.